Hi, good morning, everybody. Happy Martin Luther King Day. This is Dr. Jennie Byrne at Cognitive Psychiatry of Chapel Hill, and I'm continuing to talk today about some lessons that I've learned from my patients over the years. So today I thought I'd talk a little bit about grief. I've had a number of patients this past year and recently having to deal with grief, and I think the big lesson I've learned about grief is that it is never simple. It is very complicated. So one person I'm working with right now has just had two deaths in her family, kind of back to back within a month of each other. And she's trying to handle the grief and the different types of feelings that she's going through. And I think a lot of people have heard about different stages of grief and different feelings with numbness and anger. And that's something, I guess, that's a little more well known, is that people react differently in terms of their emotions. But I think the one thing I've learned from my patients over the years is grief is not just about mourning someone who dies. In particular, I've worked with a lot of people who have someone in their family or maybe even themselves dealing with dementia and cognitive loss. And what you see sometimes with dementia is that there are a series of prolonged grieving periods over time. So, for example, if someone has dementia and they are doing okay and they first sense something's wrong, but maybe they don't go in to get help right away, and then they go in for a diagnosis. Well, sometimes the diagnosis itself can be a loss because they've lost the idea of what their life is or is going to be. So you get a diagnosis for something like dementia, and sometimes you grieve what could have been. And this isn't just for dementia, this can be for other illnesses as well, especially terminal illnesses. You go through a grief period sometimes for what could have been or what you thought was going to be. Even before you really are sick, per se, before you have real signs or symptoms of a disease, you grieve the life you thought you were going to live, or you grieve the future you thought you were going to have. And then sometimes as the process goes along, things which seem really little might trigger a big grief reaction. Like, for example, I've worked with people who, when they stop driving, they go through a grieving process. It's a big loss for them because not necessarily the driving and the convenience of driving themselves, but what it symbolizes to them. The fact that they can't drive safely any longer. That symbolizes, either getting sick or losing independence. That's a big one. Or kind of being treated like a child again. So sometimes something which is very small seems like a big loss. Sometimes loss can be related to happy events, right? So sometimes if I've worked with people where a child is getting older and getting more independent and moving on, maybe leaving the house or going to college, sometimes the parent actually goes through something like grief and grieving the fact that the child isn't there anymore. Some people, I'm sure you've seen grieve pets. When pets are sick or when pets aren't functioning well or when pets die, sometimes that grief can be very overwhelming. And then another part of grief, which is really complicated, is anniversaries or reminders of a tragedy or a trauma of some kind or a death. Sometimes the anniversaries of deaths can trigger grief reactions in people. So I've even worked with a couple people where they had a spouse die and it was kind of unexpected and they grieved some, but they really didn't start the grieving process until the first year anniversary of the death. And sometimes it's, then things sunk in and they started to process it at a deeper level. I think I've seen people grieve with children. Again, kind of a child doesn't come out the way maybe you thought they would or you planned for them, even if it's a good thing. Sometimes you grieve for what you thought your child was going to be like, or you know how you had imagined it being. So grief is really complicated. It's never a one-size-fits-all proposition. So if you are grieving something in your life, or you're helping someone else who is, just I think understand that it's very individual, and it's not one size fits all. And sometimes the timing of it can seem strange. You know, you think that they would grieve right away, and then they'd kind of get over it and move on, but maybe it crops up later. So I hope you all are going to stay warm and safe this week. We are looking at a snow forecast here in Chapel Hill again, so we're keeping our fingers crossed that we don't get a ton of snow, but I'm sure the kids will be happy if we do. So I wish you all a wonderful week, and I'll be back next week, and we'll keep talking about some lessons that I've learned from my patients. If you or anyone else you know needs help this time of year, please reach out and get some help. Be well, and I'll see you next week. Thanks.